Cholinergic drug. Cholinergic drugs play a crucial role in medicine, affecting the nervous system in various ways. In this video, we will explore what cholinergic drugs are, types, their receptors, uses, contraindications, adverse effect, and most importantly, what cholinergic crisis is. Let's dive in. Cholinergic drugs are medications that mimic or enhance the action of acetylcholine, a neurotransmitter responsible for muscle contractions, memory, and autonomic functions. These drugs either stimulate cholinergic receptors or inhibit enzymes that break down acetylcholine. Let's take a look at the types of cholinergic drugs. First, we have the direct-acting cholinergic drugs. These drugs mimic the action of acetylcholine by binding directly to cholinergic receptors. Examples include Pilocarpine and Nicotinic. Next, we have the indirect-acting cholinergic drugs. Instead of binding to receptors, these drugs work by inhibiting acetylcholinesterase, the enzyme that breaks down acetylcholine. As a result, they increase acetylcholine levels in the body. Examples include Neostigmine and donepezil. Understanding the difference between these two types is essential for treating various neurological and muscular conditions. Cholinergic receptors are classified into two major types, muscarinic and nicotinic. Muscarinic receptors, labeled M1 through M5, are found in smooth muscles, glands, and the brain. They play a key role in regulating parasympathetic functions like digestion, secretion, and cognitive processes. On the other hand, nicotinic receptors come in two forms: NN, found in neurons, and NM, located in skeletal muscles. These receptors are essential for neural communication and muscle contraction. Understanding these receptor types is crucial for grasping how cholinergic drugs affect the body. Cholinergic drugs have various clinical applications. Let's look at some major ones. Alzheimer's disease, myasthenia gravis, urinary retention, gastrointestinal motility disorders, glaucoma. While cholinergic drugs have valuable therapeutic uses, they are not suitable for everyone. These drugs are contraindicated in patients with conditions like bronchial asthma, peptic ulcer disease, myocardial infarction, hyperthyroidism, obstructive urinary retention. Cholinergic drugs can cause a range of side effects, from mild to severe. Mild effects include lacrimation or excessive tearing, salivation, and bradycardia, a slowed heart rate. However, in higher doses or sensitive individuals, more serious effects may occur. Hypotension, which is dangerously low blood pressure. Bronchospasm, leading to breathing difficulties. And even cardiac arrhythmias or irregular heart rhythms. Monitoring patients for these effects is crucial, especially when initiating or adjusting therapy. A cholinergic crisis is a potentially life-threatening condition caused by an excessive dose of anticholinesterase drugs. This results in the accumulation of acetylcholine in the synaptic cleft, leading to the overstimulation of cholinergic receptors throughout the body. The symptoms may include muscle twitching, generalized weakness, excessive salivation, sweating, slow heart rate, and in severe cases, respiratory difficulty. Prompt recognition and management are critical in preventing serious complications. Let's look at some examples of cholinergic and anticholinergic drugs. Under cholinergic drugs, we have Pilocarpine, used to stimulate saliva and treat glaucoma; Neostigmine, often used in the treatment of myasthenia gravis; and edrophonium, used for diagnostic purposes in neuromuscular conditions. On the other hand, anticholinergic drugs include atropine, which increases heart rate and reduces secretions. Benztropine, commonly used in Parkinson's disease, and galamine, a muscle relaxant used in anesthesia. To summarize, cholinergic drugs work by stimulating muscarinic and nicotinic receptors in the body. They come in two types. Direct-acting drugs mimic acetylcholine, while indirect-acting drugs prevent its breakdown by inhibiting acetylcholinesterase. These medications are commonly used to treat glaucoma, myasthenia gravis, and Alzheimer's disease. However, they can cause side effects such as nausea, low blood pressure, and bradycardia, a slowed heart rate. Understanding how they work and when to use them is essential in clinical practice. If you found this video helpful, don't forget to like, share, and subscribe for more pharmacology content.